Good morning. I am Dr. Monnie Singleton here at the Singleton Healing Center. Our address is 1767 Village Park Drive in Orangeburg, South Carolina. And I'm delighted to be here with my friend and colleague this morning, Dr. Elvis Ali, who is a naturopathic physician, chiropractor, and lots of things that we're going to hear about, his titles. And he's visiting me from Toronto, Canada. And we are about the business of establishing a healing center here in Orangeburg, and it's where the East meets the West. And so we hope that you're going to enjoy our conversation this morning, and I'm just going to maybe turn it over to Dr. Ali to have him introduce himself, and then I'll tell you a little bit more about myself. Dr. Ali?
Good morning. I'm happy and very honored to be here.
Good.
What a wonderful scenario that I've seen in the past couple of days being here.
Mm-hmm.
My background is from the West Indies, came to Canada. My four sisters became nurses, and I chose to become a naturopathic doctor. I did get accepted to go to university at Wilfrid Laurier in Toronto area. It's about an hour away in a little town in Kitchener-Waterloo.
Mm-hmm.
Why I chose to become a naturopath? A lot of people still ask and question me, why did you start into naturopathic medicine?
Mm-hmm.
Being accepted and got accepted to a university in the West Indies for medical, I actually looked upon my history of what you're doing here.
Mm-hmm.
That was over 4 decades ago. My dream was to have something similar to this, but I didn't have the cohesiveness. I didn't have the background of doctors working together. In the past 3 days, I've seen complementary doctors. The reason why we don't have everything, we don't know everything, but having doctors in different disciplines, you bring the best of everything to one thing, to heal that patient. And what I was very touched upon, every day we come in, we do a prayer, because it's up to him.
Yeah.
He does everything. We are just his disciples to fulfill and take that patient not only to the next level, but I want people in this facility to go beyond the next level.
Mm-hmm. Well, and you mentioned that some years ago you had an idea of this kind of facility. Well, guess what? I did too. And what I've come to realize is that years ago was ahead of its time. And everything is in God's timing. Had we done it then, 25 years ago, we would have been ahead, 25 years ahead of what was required and what was needed. And it would have been a flop. And so when we are patient and wait on God's timing for things to happen, then it shows up at the right time. Look at all of the technology that is available now. It wasn't available back then. And I had a similar experience, because when the vision came to me 25 years ago to do this, I was under the opinion and impression that, wow, look at this wonderful vision. I need to get this done by sunset. And so I went about the business of trying to get it done, and it was a flop. I wasted a whole lot of resources, financial, human, all kinds of resources, and realized that it wasn't the right time for it. And over these 25 years, it has been a season of preparation for us both. I didn't know you 25 years ago, and you didn't know me. And so even the way that we came together was God's plan. And it wasn't 25 years ago.
They say timing is everything. But for the audience out there, I want you to understand, we all went through COVID. Because of COVID-19, people now are more aware and conscious of their health. They want natural products. They know what they were given from the medical point of view to help strengthen the immune system. But it opened up the eyes for a lot of people. We live in a place now, unlike where we originally came from, our forefathers in the West Indies. We now know, because of globalization, people are coming into this world in North America from whatever country or islands they came. They want natural therapies. So one of the things that I said yesterday is it would be an honor for me to come to Orangeburg to help to educate the people. This is a field of education in my field of nutrition. When to take it, when not to take it. If somebody's on medication, there may be contraindications. So by working with you and your team, we come into an area of education so people can empower themselves. They can be confident with good quality products. I don't have anything to say about drugs because I know GMP qualification, every drug has a DIN. Every drug has been tested.
You'd mentioned DNP. What is that?
DIN.
DIN.
Every drug that's made in the world, whether it's from Africa, whether it's from India, whether it's from West Indies or United States or Canada, it has to be tested in a good manufacturer practices. It has to have a site license where it's made, and only then they get a DIN, a drug identification number. The other thing I mentioned also, NPN. That is every herb, vitamin that's put into a capsule, a tablet or a liquid, it has to be made also in a site license approved by the government, and that is only given by Health Canada, the Natural Health Products Directorate, and we can put on any vitamin or supplement NPN, natural product number. So be aware, everybody is shopping online, but what's on the label, is it really on the bottle on the internet? Not necessarily. So we have to really educate our patients at the Singleton Healing Center.
And you also mentioned the influx of people through globalization that were showing up here, but the people that we treat here in Orangeburg, South Carolina, actually grew up here, they're from here, but it is because of especially the African diaspora, that they knew about these herbal medicines and products. And so though they were born here, their parents, their grandparents, great-grandparents knew about herbal medicine, and they would go to the bush to get treatments. They didn't have money to go to the doctors, and so
you hit the nail on the head. Just talking to some of the people who were here yesterday, they said, my grandmother knew about things like cod liver oil. Who would have known when our parents were given to us, awful tasting, now it's in a capsule. What's cod liver oil? It's got vitamin A. It's got vitamin D. So years ago, people didn't know. Even through COVID, studies were done. They found vitamin D was deficient in those who had full-blown symptoms with COVID-19. Wouldn't it be nice if we could educate people that to build up the immune system instead of being vaccinated? No offense, we need vaccine. It has a purpose. But we're in the business of prevention. If we can build up the immune system, make it stronger, I'm not saying we give vitamin.
And this is where treating chronic diseases and prevention come together so well. Absolutely. Because from the standpoint of what I do, people already have diabetes, they already have hypertension. So it's not just a matter of them taking a supplement, but it's a matter of them continuing to regulate their blood pressure through the medications that are available, and training them through education, eating the right foods, exercising, bringing in the appropriate supplements, that over time we can decrease the medications that are prescribed for the conditions, and they take more of the supplements, they eat properly, and they exercise regularly.
if I could expand briefly on this,
Mm-hmm.
you have a staff that is so gifted,
Mm-hmm.
and I met staff and the nurses, and they take a lot of pressure off you because you could prescribe certain things, but the follow-ups, and I spoke to one individual, then I spoke to others in the nursing, and they educate the patients.
Mm-hmm.
Unfortunately, the system in North America, where I come from in Toronto, the doctors don't have time.
Well, you know what? The beauty of what we are creating is we're creating a model that fills in those gaps. And if the doctors were doing it, then there would not be a place for what we are doing. So, in a sense, it's a blessing and not necessarily a curse, because here it is coming at such a time as now.
Right.
We are able to offer that education that is so important. And look at what's available now through the internet. And now we can build education programs and systems so that we show them how to go to the internet to access certain information. The information that you're going to be providing through seminars and lectures, they'll be able to go to the internet and get. And that was unavailable 25 years ago.
That's for sure.
So
Well,
it's all
like
about
I
time.
said, by having somebody, because doctors are busy,
Mm-hmm.
the average amount of time a doctor in Toronto, where I come from, I can speak because of my family background, they don't have the time. But when I saw you have the team around you, do you know that when a patient comes to see the doctor, there's X amount of time? But that patient, when they see your associates that take the time to go over their drug chart, to go over how are you feeling, how are you really feeling today, that patient feels wanted. And we work like a team in my practice in over 40 years, is that I'm the coach,
Mm-hmm.
you're the quarterback,
Mm-hmm.
and I can teach you in your own analogy that I can tell you, but when you're on the field, it's your time to shine. I want to empower women, especially when I talked about menopausal women, and it's all over the news. Take natural HRT, take natural vitamins. Natural HRT is different to synthetic HRT. So it's very important to understand that if we educate the people, you have a choice. You can go the medical route, which is fine, and then I will deal with some of the side effects, maybe, and I can help to detoxify. You could choose the natural route, where there's minimal or no side effects. So by working together as a team, the patient benefits. They have the both of the Eastern medicine and of the Western medicine. And if I may take a little bit of time now to digress now to tell you about what I learned in Eastern medicine as opposed to what we learn in Western medicine. Observation, looking at the patient. This morning I did a Zoom lecture on electromagnetic fields. When my instructors in China looked at the patient, your picture reveals. Look at my frown. Do you see these lines? Chinese doctors say when you have these lines, it's a sign of abdominal problems. Be it diverticulosis, be it Crohn's disease, be it an ulcer. We could see things before it happens. That's the benefit of Chinese medicine. We can see things before, and we can give you the tools to rectify, be it an organ or organs, to help to prevent. We wait too long as patients to see doctors here. We want quick fixes.
And I'm so excited about the new technology that is available, that we don't need to rely on the Chinese doctor or the doctor who's trained in Chinese medicine to recognize the lines, but now there's technology that a device can take a picture and look at those lines and do the same thing in a fraction of the time.
Absolutely.
That the practitioner.
We didn't have it 25 years ago, as you said. timing. Now is the time. Now is the time.
And so I'm very excited to get this technology in the Healing Center because it's going to really revolutionize how we evaluate the patients, how we screen the patients, and the recommendations for treatment. This device that we're talking about and looking at not only does the assessment, but it also makes recommendations for diet.
Absolutely, that's the healing machine.
Yes.
So we will learn and understand more, and there's machines, that same machine can grid you from a Chinese perspective,
Yes.
Chinese medicine, we call them meridians. So for the audience out here, when we talk about meridians, it's like a highway. And if I can use the analogy, we have a car accident here, we have pain here. So the car accident is here, but we have a blockage of 2 or 3 miles. So when a patient comes in and they say they have a pain, be it tennis elbow, the problem could be internally, it could be a liver problem or a heart problem, circulation. So one of the differences that I learned in the holistic medicine, look at the causes of the problem. The root of all causes. So when I was teaching at the Naturopathic College, I was teaching medical doctors, and I was able to teach them, when your kid comes in with a headache, they don't lack aspirin. Look at the causes, why they have a headache. Could be water, hydration. Maybe they didn't sleep well. What about another child who comes in after playing soccer and the parent brings them to our clinic and they say, oh, we have muscular, it's like pain, so it's cramping. The body does not lack an analgesic or an anti-inflammatory. Calcium. We learn from anatomy, give the body what it needs, the body will heal itself. So that is one of the things that from Western medicine, we will educate the people to be aware of the causes of the problem. Drugs will work. We have athletes who make a lot of money. We need to get them fixed, tape their ankle, sprain, get them back on the court or the field. But for people and all our patients that come in, we can educate them the causes of the problem. Not only they would be happier, less side effects on taking certain medication, but they will know what to do in the future to avoid these problems.